You're watching CTOM TV. Knowledge is power.
So the next one is neoadjuvant PD-1 inhibitors, such as pembrolizumab. As we know, PD-1 inhibitors inhibit the PD-1 pathway. We have some great videos on immunotherapy. So typically across cancers, PD-1 inhibitors, on average, in unstratified patients have about a 9% response rate to the drug. So when they gave this drug to patients, it didn't really, work all that well.
Oh, that doesn't sound very impressive.
However, in a recent study, what they did was that when these patients had recurrence, and before they went in to cut out the tumors that recurred, because they caught these tumors in time, and they said, patient's been through treatment. They said, okay, so your tumor's back. Let's cut it out again. Well, what they did was they gave them PD-1 inhibitor, pembrolizumab, right before they did surgery, up until the time they did surgery. And then they did surgery on them. And they found that what happens is when you do that, it increases the T cell infiltration into the tumor, which means that part of the immune system is responding. And so in this study, the patients who had this before they had their surgery survived 417 days, which is pretty good considering recurrent survival on TMZ alone is 4 months, 4.5 months. Mm-hmm. So these people live 417 days on average, compared to only 228 days for the recurrent patients that didn't get this drug.
So about 16 months versus just a few. Yeah.
It's a big difference, it's almost...
And that's just adding a PD-1 inhibitor?
Prior to surgery. Neoadjuvant PD-1. Yeah, and so what they found out is they found that there was certain, subsequently from this, and we've spent a lot of time on this study. It was a very important study for us because, we do have a lot of GBM patients, and we like to know that if they're going to go in for surgery, then if there's something they can do to boost their chances, anything helps. So what we found out is that if patients had this treatment and they had a PTEN mutation, they are less likely to get a benefit from it.
Oh.
So you want to know this information once again, sequencing.
Because otherwise you wouldn't want to bother with the PD-1
exactly.
inhibitor. Right?
It's not going to work if you have PTEN. Now, if you have enrichment in MAP kinase signaling, alterations in BRAF and so on, then you're going to have an enhanced response to this.
So back to
sequencing.
Get your tumor
sequence.
Yes, and then have someone review it so that you know how to make the best use of that information like this.
Thank you for watching CTOM TV. Subscribe below and stay informed.